do you want more volume in your lips, or do you want to try to get rid of some of those lip lines? Well, filler can help, and the results are instant. I'm going to show you how we do it, and this is called the Rejuvenation MD Lip Lift. So we have got some filler in hand. We use some numbing cream, and we're using some ice because we never want to have discomfort. But it is a needle, so we may have a little discomfort. And you let me know when you are ready to go.
Go for it.
All right.
Use my little buzzer.
Oh, yep, there you go. Okie dokie. So I'm just going to start here. 1, 2, 3. Here we go. And you okay?
Mm-hmm.
So just little tiny droplets all the way across. It's a little, doesn't take that long, but just like to do just little. You okay?
Mm-hmm.
Bits of filler. And so lip filler can last you 6 to 9 months, sometimes even up to a year. It really depends on what you do with your lips. If you're a smoker, it's gonna last less long. And I don't really recommend lip filler for smokers, only because you'll be upset that you have to keep coming back for more. If you love small bottle tops, straws, that sort of thing where you're constantly pursing your lips, it's not gonna last as long. But if you aren't that kind of a patient, then it can last you, like I said, some fillers are 6 months, 9 months, even 12 months. How you doing?
Really wasn't bad.
Oh, good. I don't need to sound surprised. Okay, so we're gonna go and do the other side here. So you can see just how much further up this one side is than that other side, just halfway done. So that's kind of cool to see. Okay, here we go. Well, let's check how much we used over on that side first. Okay. 1, 2, 3, there we go. I always tell people too, lip filler is like water on a dry sponge. So you never want to push on it, or at least for the first few days, you don't want to push on it because you'll push the water right off that dry sponge. So anything you do that, again, crushes it is going to distort it. So you just want to be super easy on your lips the first few days. Again, avoiding small bottle tops, straws, heavy smooching, anything you need to pucker for really should try to be avoided for, at least for the first 3 to 4 days. And we keep going. We're just gonna travel down. And if you watch any of my videos, any of my other videos, lots of times I'll use a cannula for lips, but this way seems to give a little bit more lift. So it just really depends on what you're looking for. Let's see, here we go. Oh, we have a little buzzy, it's a little distractor. That's what that little vibration thing is that you might be hearing in the background. So yeah, those are really cute. Okay, if I have to say so myself, which I do. Okay, so now I'm going to come down and do some of, oh my gosh, they're even cuter on this direction. Oh,
Oh, my eyes are watering.
Oh, sorry. She's crying, she's so happy.
Oh, I know.
I know.
Pleasantly surprised at the lack of pain.
Oh, really good. Okay.
Yeah, little pinches.
Yeah.
And then it's done.
So we may come back, but look at how cute. Oh, okay. So now I get very excited because it's all about me is what I usually tell patients. Just kidding. Of course, it's all about you. Okay, so let's do the bottom. There we go. 1, 2, 3. A little love right here. La 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 la. And just little aliquots. And as we pull it down, it'll give you just a little more oomph coming down. So it can be not as bad as you anticipate. Especially when we add some numbing cream, we add some ice. Oh, I didn't even let you ice the bottom, did I? Sorry. Look at you, rock star. Great. Just little tiny plugs. And there's all sorts of different types of lip filler out there, but they're all made of high hyaluronic acid, which is what we have in our system to begin with, in our skin to begin with. We just also unfortunately have an enzyme that eats up our own high hyaluronic acid, so that's why we want to replace it sometimes. And you'll notice a lot on commercials, a lot of skincare products will have, well, they'll say hyaluronic acid is in this. Maybe not with that high-pitched voice, but they'll say that, and it's because it's super hydrating, because when you have lots of hyaluronic acid, your sponge is full. And that's exactly, oops, sorry, let me wipe one more time. So we're just replacing what we lost. We lose 1 teaspoon of collagen a decade. And each of these fillers is generally 1/5 of a teaspoon. Majority of them are 1/5 of a teaspoon. Sometimes you can get half syringes and then it's only 1/10 of a teaspoon. So it's not a lot of filler. And I always tell people, if you see people with filler and you don't like it, it's probably because they just had too much. So you can stop. You know, like I said, you see that it results immediately. And so there's a way to stop doing filler. You just stop injecting. When we stop injecting, you're not going to end up with bad filler, because we'll be able to see it right away, and then we just decide, okay, we're done. So that looks really cute. And what I'm going to do is I'm just going to sit you up. So maybe I'm just going to have you come and sit up for me, because you're strong. Oh, are those so cute? All right, I think I want a little bit more over here, but we can do all the little nuances offline. But do you want to see real quick?
Yeah. Oh yeah.
I'll show you. There you go. Look at that.
Oh yeah.
Aren't those cute? Yeah. So and
nice and bleedy.
Yeah, I know. Well, a bunch of different pokes, but what'd you think of the discomfort associated with that?
It really wasn't bad.
Okay. Awesome. All right. Well, there you go. So if you want some more volume in your lips, if you want some lift, if you just want a cuter little pout, lip filler can definitely be for you. It doesn't have to be painful. And go to experienced injectors like us at our Rejuvenation MD. We have 3 female physicians, and we're in the top 1% in the country of over 45,000 offices that do this in the United States. We're in the top 1% with how much we do. So we do a lot of filler. We love it. We stay on top of new techniques all the time. So if you enjoyed this video, please share it, like, follow us, subscribe to YouTube, and most importantly, come and see us. See you soon.